Good morning, everyone, and apologies for the little delay. Welcome to this press conference following the publication of the new risk assessment by the European Centre on Disease Prevention and Control. Today we have with us Commissioner Kyriakides and the Director of the ECDC, Mrs. Amon. I will first give the floor to the Commissioner and to the Director to make some introductory comments, and then, as usual, I'll open the floor for all questions that you may have. Commissioner, the floor is yours. Thank you.
Thank you, and good morning, everyone. COVID-19 is the public health crisis, of course, we have all feared. It has turned upside down the way we live our lives, how we interact with each other, how we are when we are in social spaces, the way we work. I would say that no part of our lives has remained unaffected. The disruptive but necessary restrictions placed by most member states during the spring did manage to slow down the spread of the virus and allowed us to slowly but gradually start to get back to what we have often said will be our new normal. However, the much expected and I would say needed lifting of some of the restrictions during the early summer has led to what we have continuously cautioned against, an increase in cases. As you will hear from our Director, Andrea Amon, in some member states, the situation is now even worse than during the peak in March. This is a real cause for concern. What this means, to be very clear, is that the control measures taken have simply not been effective enough or not being enforced or followed as they should have been. This is clearly underlined in the updated risk assessment to be presented today by ECDC. While people testing positive for COVID-19 are younger in several member states and mortality rates remain lower than before, we are starting to see an increase in the occupancy of ICU. We cannot lower our guard. This crisis is not behind us. Moreover, autumn and winter are the time of the year for more respiratory illnesses, including seasonal influenza. To prevent what could potentially be a lethal twindemic of COVID-19 and the flu, which could overburden our health systems and lead to more loss of life, we need to increase the coverage of vaccination rates. Today, against what frankly is a very worrying background, I see an absolute necessity to send a strong and clear message to member states that our recommendations on short-term preparedness that we issued in July are more valid than ever. From stepped-up testing to closer contact tracing, from improved public health surveillance to better access to personal protective equipment and medicines, and ensuring sufficient healthcare capacity in ICU units, all member states need to roll out measures immediately and at the right time, at the very first sign of potential new outbreaks. Of course, I will say it is encouraging to see that progress has been made, notably on the agreement of a common EU approach to testing. And I urge all member states to follow this. We still see, and we are hearing now, from several member states, how they're moving across with implementing the urgent actions we presented in July. But hearing that today we are okay is not enough. Are we planning for the worst-case scenarios? We have put in place tools in the EU to support this effort, as was required and asked of us. Joint procurements for supplies for intensive care units and treatments are there to be used and plan ahead. We have delivered the first batches of the only authorized COVID-19 treatment, remdesivir, purchased under the EU Emergency Support Instrument, and are already in negotiations for the next joint procurement for this. We are negotiating with pharmaceutical companies for COVID-19 vaccines. As many of you know, have concluded 2 contracts so far to ensure access to such vaccines once proven safe and effective. Finally, we're working with member states, and we will insist on a coordinated approach on free movement restrictions to ensure more clarity and predictability for citizens. We have already presented this proposal, but we have not yet achieved member state consensus on this, and I urge member states to move ahead. It is extremely important. But with the COVID-19 vaccine being months away, I'm deeply concerned by what we are seeing now and what may follow in the coming weeks and months. We all need to understand that finding a vaccine will not be a silver bullet. Citizens, we all are the first line of defense against COVID-19, and our self-discipline to adhere to measures will determine the next months. We must prevent a situation where governments feel they have no choice but to impose generalized lockdowns. This will be detrimental to our mental health, detrimental to our economies, detrimental to the well-being and the education of our children, detrimental to our working and daily lives. We have to take measures that will protect those around us, whether they are parents or grandparents or those vulnerable in our societies. To support member states, we have also today, with ECDC, issued guidance on non-pharmaceutical interventions. Andrea will be speaking about this immediately after myself. These are the most effective public health interventions against COVID-19 that we have today. We are, in some places, and I understand, witnessing a real COVID-19 fatigue with physical distancing and an apparent disregard of the norms, and even we're seeing protests in some member states. This needs to be addressed by member states, and we need to find ways to deal with it. I urge member states to reach out to young people, to make them understand the situation that we are all up against. We need to do everything possible to fight misinformation and fake news, which is creating even more confusion in citizens. And Andrea will be able to speak a little bit about what we're seeing now in the new cases of COVID-19 in relation to the age demographics. Here, I would call on member states to be consistent and coherent in their communication and ensure as much as predictability as possible to allow citizens and businesses to remain and have a sense of control. I am convinced that predictability and clear communication to citizens and coordination with other member states will increase compliance and protective measures. I have already stressed, and I cannot stress strongly enough, that we are responsible for each other. We must all, regardless of age, regardless of vulnerability, continue to keep physical distancing, wear face masks, take care of hand hygiene. Try to meet the person only within our social bubble of relatives, and stay home when we feel sick. Ladies and gentlemen, we are at a decisive moment. Today we're here to call on everyone to act decisively too. It might be our last chance to prevent a repeat of last spring. I will now immediately pass the floor over to Stefan and to Andrea, and Andrea will present the details of the later ECDC assessment published today, as well as the guidance on non-pharmaceutical measures. Thank you.
Thank you, Commissioner.